have myself. My name is James. I'm a young adult carer with Caring Together in the Norfolk Young Carers Forum. We have Axel, who will also be helping us. We have Heather, Lynn, Tom, and we also have Andy as well. So I'm going to hand over to Axel, who's going to take the next slide.
If I can unmute myself, there we go. So just a bit of housekeeping. No need to worry about fire exits though, because it's all online. It's always handy. So just a reminder to remain on mute if possible, because even the smallest amount of noise gets picked up when it's online. If you come up with any questions about how you can help as a result of what you've heard tonight, feel free to put it in the chat box and we'll answer as best as possible at the end. And please feel free to use the hashtags and handles on Twitter, Instagram, and Facebook throughout the night. So tonight we are doing the welcome and introductions now. At 5 past, we'll be doing COVID-19, the voices of young carers and young adult carers 1 year on survey results. At 5:30, there'll be a chance for the questions to be answered. And at 5:50, there'll be some closing remarks and thank you. I'll pass back to James now.
So just an introduction and background of why we did this survey. So we were looking at getting data from the survey that was carried out at the beginning of the pandemic. And we wanted to get some up-to-date statistics and have a better understanding of the impacts of COVID-19 currently and how that's going to affect young carers and young adult carers in the future. So just having a look on the next slide. So we had 149 responses in total from young carers and young adult carers across Cambridgeshire, Peterborough and Norfolk. Just a quick side note as I go through these percentages, they won't all add up to 100%. So they will be beyond that, and that's because some people care for more than one person. So for the young carers survey, we discovered that 68% of young carers cared for a parent or guardian, 51% cared for a sibling, 6% cared for a grandparent, 5% for a friend, and 2% cared for a neighbour. And with the young adult carers survey, because we did two, 62% of young adult carers we found were caring for parents, 43% for siblings, 8% for grandparents, 3% for a friend, and 3% for a partner. So I'm now going to hand back over to Axel, who's going to take the next slide.
I'm really struggling to unmute myself tonight. So yeah, the main question asked was how well young adult carers and young carers coped during the pandemic. So the figures on screen show an average of how many carers felt that they coped before and during the pandemic. And yeah, so 7 out of 10 felt that they were coping before COVID, and that dropped to 5 out of 10 during COVID. So I'll now hand over to Lynn to look at carer awareness.
Hang on, I'm a bit messed up here. Got it. We'll be looking at the awareness of young carers and young adult carers during COVID-19. As you can see from the figures above, they show there is an obvious gap in terms of carers' needs being recognised throughout the pandemic, with 7 out of 10 young adult carers felt that their needs were not recognised during COVID-19, whereas 5 out of 10 young carers felt that their needs were not recognised during COVID-19. This is some of the feedback carers gave us in this survey in terms of awareness raising for young carers and young adult carers. Some of the responses were, we need more help and support to keep going, more awareness raising of young carers and young adult carers, And I think that more people need to be aware of carers who are struggling at home with their education. I will now hand you over to Heather.
We're now going to be looking at the mental health of carers. As you can see, 33% of young carers said that their mental health had been slightly negatively impacted by COVID-19. 50% of young adult carers said that their mental health had been negatively impacted by COVID-19. And 56% of young adult carers felt they didn't have a break from their caring role throughout the pandemic. These are some of the comments from the survey. They demonstrate how COVID-19 has negatively impacted the mental health of young carers and young adult carers. They felt that they said they missed their friends and their support group. They felt rather low and lonely, and that they felt trapped in their own house. As you can see from the survey results, young and young adult carers receive support mainly from their parents, guardians, and other young carers and or their youth worker, but not as much help from GPs and or doctors and online and tech services such as Covert and Chat Health. This very clearly shows that there is a gap as to where support is coming from. These
Has this jumped the slide because my computer glitched for a second?
It's gone back to the previous slide.
Hang on a second.
This was some of the feedback received from the survey about the support carers felt they needed after the pandemic. They said they wanted breaks from their caring role so they can be kids. They wanted young carers groups, counselling and mentors, and peer support. I shall now hand you back to Axel.
So I'm going to look at some of the effects that COVID had on the impact. No, I'm going to look at what effect COVID had on carers' education. So 36% of young and young adult carers felt that their education had been negatively affected by COVID, and 26% of young adult carers felt their education had been slightly affected negatively. So some of the quotes that we got from the survey were, I struggled to understand the online work, I can't focus, I missed lessons due to learning, and they had device and internet issues. So some of the, I don't know what I'm saying, hang on, bear with me. So these are some of the views that carers had on their career choices and aspirations. So some said that they didn't get a chance to do their exams, which would have helped them get to where they want to. I haven't been learning what I need for my choices, and I'm no longer certain on what career I want to do. I'm now going to hand over to Tom.
Okay, so the next and last section of the survey was covering finances and employment, and was also only available to young adult carers. Okay, so 59% of young adult carers and their families have been financially impacted by the pandemic. So this is including some people losing their jobs and some people being put onto furlough, as well as some people having to use facilities such as food banks. Okay, so 50% of the young adult carers who responded are currently working. So 66% of the responses that are working told us that they were at least partially furloughed. Some of the comments that these carers have made is that it's lowered their mental health, that they're no longer in work, and that they do not have enough money to cover their bills. I will now hand back over to James.
So, first of all, thank you very much to all the presenters who just presented the results. What we'd like you to do now is have a think about what you guys are going to do within your roles as a result of what you've heard today. And if you could put it down in the chat, that would be amazing. And also, please do feel free to raise your hand and ask any questions. Andy and I will do our best to answer them.
So for those of you who haven't seen on the chat, so Lauren's put in here that she'd love to get some peer support or mentoring in place, but can't at the moment due to year group bubbles. I think obviously the ability to do sort of face-to-face support we know is going to be a restriction for some time. I think we're really keen to look at how we can use some of the virtual side of things available to be able to sort of to produce those sorts of opportunities. But no, it's definitely something that's come up that's going to be really needed. Lots of things flooding through on the chat now. Just to going through some of them. So Maria said about the results. So absolutely. So what the young people have helped produce with our engagement team is an infographic with some of the results, and then we're also going to be doing a summary document of all the different headline results and what we're doing as a result, which we'll share to everyone after the event. So that should hopefully be coming out to you tomorrow. So that was in relation to Maria on that one. There's a question, Maria. Did you want to come in about your question in terms of about the difficulty that you're having at the moment?
Yes, thank you, Andy. So we got the Young Carers Tick Award this year, so we're very much focused on our young carers, and in fact all our carers. So for the first time, we've put all carers on our vulnerable list to contact over lockdown. But what we found is that those that were really struggling at home with the caring role and being in the house 24/7, we were able to offer them to come in on campus, socially distanced with all our COVID rules. But then the family members that they were caring for were very vulnerable and were really not keen on them coming on campus. So it was a bit of a rock and a hard place situation for us, where we were able to offer them a bit of a solution, but then obviously in the family home they weren't able to take it up. So just wondered if anyone else had a similar issue and could offer any advice for it.
Before I come in, does anyone want to come in with any thoughts if they've had similar experiences or how they've approached it?
I will say, from a young carer's perspective, I've been through exactly the same thing. My sixth form wanted me to go in. I was falling behind on work because I just simply couldn't do it at home. I couldn't concentrate and I didn't have the time to do it. And it's you know, we feel exactly the same because I want to be able to get the work done and I want to be able to push forward on my studies, but I live with my nan who has had to shield. My mum is also very vulnerable, and trying to pick which one I want to prioritize, my mum or my studies. Unfortunately, it has to be my mum. Yeah, I say unfortunately, but you know, I have to prioritize my mum and my nan over my studies, and it is such a difficult thing. But I will say that all young carers do want to get back in. It's just a case of safety.
I think what we've seen from other schools coming in is in terms of just having that regular contact, in terms of actually just young carers knowing it's there and know it's available, but also just having that regular dialogue as to actually what other ways there are around it. We're hoping that particularly for young adult carers aged sort of 16, 17, but also with family members starting to get the vaccination, that should hopefully start to encourage more people to feel sort of confident, because we have seen it all the way through the pandemic where people have been worried about going into school, about getting public transport. It's been a real issue. So I think what we've seen with other schools and colleges is just having that regular dialogue, finding other ways that people can link in, and just so that the young carer knows how to access work and be able to access things. And similarly, we've been providing sort of bursaries for tablets and devices, and I think there's a question from Ruby in a second just on that area. But I think that's been one of the key things to try and to remove those barriers. But do any of the other young carers want to come in on any other thoughts at all? There's absolutely no obligation to. No? Perfect. So just going to the, so it's going again through the chat in terms of, so Ruby, you mentioned around sort of digital devices and internet. Did you want to come in there at all?
Yes, thank you, Andy. It's more a question around accessing healthcare using digital devices. So I wasn't sure if this was the place to ask the question, but thank you for letting me. I was just wondering whether you've got any insight as to whether access and issues encountered with digital devices and internet that you've experienced with education have also impacted access to healthcare, because a lot of our appointments, particularly outpatient appointments, have gone virtual via a platform called Attend Anywhere and telephone clinics. And I just wondered if there were any insights into that.
I think when I looked at the slides, one of the things that was really interesting to me was just how low down health came on the radar in terms of where young carers and young adult carers got support from. So I think in terms of actually just it shows there's still a lot more to be done. So for example, even things like COOF, which is a service that's been promoted around around mental health, just until that came sort of scored quite low on the sort of how many people have used them for uptake. So I think it would be good to explore, because there has been lots of work that the forum have done and other young carers with people like the 0 to 19 Healthy Child programme, with obviously yourselves. So I think there's still probably more we need to do about young carers feeling confident and able to access their own health appointments, or knowing where they can go for support as well.
Thank you. That's something we'd like to look into too. We're making a concerted effort now with young carers. Now we've got a team in place. So thank you.
Brilliant. So there's lots of other comments coming in about what people are going to be doing. So sharing the results in terms of sort of raising awareness coming through here. So Maria, so you've got a question here. So what would really help young carers feel are getting ongoing support? Did you want to come in there at all?
Yes, thanks, Andy. I'll just pop my video on so you can see me. I was just really bothered, actually. I mean, obviously mental health and well-being has been a big thing for everybody during COVID, but particularly young carers and young adult carers. And then it really bothered me when we got to the slide about where people felt supported, that actually very few young carers and young adult carers felt supported by COOF and Chat Health, which were services specifically out there to support young people with their mental health and well-being. So what can we as services do better to support you?
Do any of the young people have any thoughts about in terms of what more can be done in terms of, is it around where information is around these support services? Is there more to be done to make them feel more accessible to young carers? In terms of where do you guys go in terms of, or where do your friends or other young carers in your groups and organisations, where do they tend to go most for their support in terms of around their own mental health?
Personally, my mental health got really bad over the last lockdown, and I ended up doing a self-referral for the wellbeing service. I did get I got, we'll say, referred to COOF, and I, having told my friends that was where I was told to go, I got quite a few negative reviews about COOF, about how they struggled to get on with it, about how it didn't really help them, and that really put me off. Hearing that my friends have struggled to be able to get on with it, and I struggled to get on with any sort of thing like that. So hearing those bad reviews sort of just put it to the back of my mind. I didn't want to even try it. That's definitely been my, I mean, I've not actually used it because I don't trust it.
Don't mind me jumping in, Andy. I think one thing that, just from, I know we've had quite a few discussions with the forum about this. One thing that I think a lot of sort of accepted is the fact that we didn't know COVID was coming. We couldn't prepare for the fact that we knew there was going to be an influx. So otherwise we'd have all taken on a lot more staff and all the services would have tried to be better prepared, but that's the nature of these things. I think part of what tends to put things off and what we can do about it is something that I think everyone's going to have to take away and think. But it's almost the waiting times and things. A lot of these services you go on and it's you get the standard, we're really busy at the moment, we'll get around to you as soon as we can, which immediately puts doubt in people's minds. Is my call as important as other people's? Is it worth taking the time to wait? Have I got the time to wait? Because it says that it could be up, over half hour waiting, but actually, young carers, young adult carers tend to be quite busy. So I think that's a large part of it. It makes people feel like just a number rather than an individual with their own needs and their own sort of, their own situation. So not really offering much of a solution, but I think that's something that one of the big problems that a lot of people come across is feeling just another case for a lot of the people with these services. They're getting the same questions asked to them with the same suggestions coming out of them. And it's all very sort of, each instant is very isolated and, not talking to one another. So I think that's something that I know has come up when we've discussed this previously.
I think that is a big factor in it, is waiting times, funding, all of that sort of stuff, because I'm in Suffolk at the minute. And because I'm at university, I've not been able to go home and see mum. I saw mum for the first time in a year at Christmas, and then I had to leave like 2 days after. But I think that's one of the big things, is that I've been on a waiting list for therapy for 6 to 8 months now. I'm not quite sure how long, but I've just been referred to another mental health place and another mental health place, and it all builds up and you just kind of feel like you're getting forgotten, is the big thing I find.
I think what you guys are saying is just really sort of hammering home to me. So we've been doing some work with, for example, with Coof, about trying to make them more aware of young carers and trying to get sort of young care awareness, just because actually they need to be showing to young carers and say, actually, this is why we can help young carers, this is what we can do. But I think these results will sort of really help us to go back to them and say, actually, look, in terms of 149 sort of young carers and young adult carers have had the opportunity to access Coof, yet look, we're talking single figures in terms of those who've accessed it in the whole past year. If Coof want to be reaching those who need their service the most, this is something they've got to take really seriously and think about actually what are they going to do to take that forward as well. There's a question that came up in the chat just around that sort of mental health was from Maria. Maria Watson. Apologies, I'm not sure if it's Maria Watson or Tiff Ward. It's got 2 names on one Zoom account, but just around sort of peer mentoring that they offer and just what around that side of things. Didn't know if you wanted to come in to talk a bit about it.
Yeah, we've been offering peer mentoring for some time. We've actually been really lucky that we have 2 UEA placements with us at the college. So one's at our lowest off campus, the other's at GY, because not everybody needs therapy. And what we quickly discovered is that actually somebody just empathising with your situation can kind of help you through. And actually, because they're UEA placements, they're really good at helping manage coursework and some of those difficulties. So what we decided to do was roll that out to other students, because peer mentoring is actually something that works really well for those that have got that lived experience. So what we do is we offer that training in-house to our students, but obviously being part of this network, if that's something you felt would work for you, as I wrote the training, I'm not precious about it. I'm happy to kind of help with sort of sending that out if you think that's useful, so I can sort of deliver it and then you can take it forward yourselves.
Brilliant, thanks for that. I think it's really useful. I think it'd be really great to sort of link you in with some of the young carers to actually, because I think I saw in the chat in terms of it's getting that balance. young carers and young adult carers have got plenty going on for them at the best of times. So the last thing we want to do is add more onto them. So great, take on the role of peer mentors. Whereas actually, if some people are doing that role informally, which you can see from the results they clearly are, they're offering that support to their friends and linking in, actually giving them the opportunity to actually get some training around being peer mentors, helping improve their own sort of self-confidence around actually what they're doing. Again, there's been lots around employability and life skills. I think for me, one of the key things I'll talk about a little bit later is just around helping young carers see what skills that they've already got that employers would absolutely love to get and to benefit from. So it'd be great to look at that. So brilliant. Looking here in terms, so we've got Jody Deard, so who's from NHS England.
James had his hand up for that last one.
Oh, sorry, James, do you want to come in there, James?
I just wanted to add on to that one. As somebody who has been a peer mentor and being peer mentored, I definitely think it helps. From both perspectives, I'd say it benefited me as a peer mentor, because although I was mentoring a younger student, I definitely felt like it was helping. It was almost like we were helping each other. So I would definitely say peer mentoring really, really does help, and it sometimes will work better than therapy or whatever, and it's a lot simpler.
Brilliant, thank you, James. Getting that lived experience is actually the benefit on both sides of the fence is so useful there. And I think in the chat is absolutely exploding with interest in the peer mentoring side of things. So I think there'll definitely be some appetite for taking that forwards, moving forward. Brilliant. Jodie, did you want to come in around the support app that you were mentioning as well?
Yeah. Hi, and apologies for arriving late. So for those that don't know me, I work for NHS England for the region to help support carers. But in my previous job, I worked as a carers lead at a hospital in Hertfordshire, and I worked quite closely with their young carer in Hert's team, and we developed quite a basic app with the local college, and it was available on Google, but not now. So part of that work, I then became involved in a more national app development program, and it's up north and Hertfordshire. So it's being developed with an app developer, and it is due to go live in the next couple of days, just very softly. It is available on the Apple Store. So what it is that you log onto the site and there's different localities. So we've got Hertfordshire on there, and it will link you to Hertfordshire's services because I've been part of the app. But then they've got lots of different topics which is generic across anyone. So any carer can log on to it, and I'm just going to have a look at it, what's on there. But there's things about where you can get support, relationships, education, calm zone, career skills, conditions, your health, mental health. So all those topics and information are quite generic because those things are applicable to a young carer wherever they are across the country. But if they want support within their local area, like the local care organisation, well, then they would go into the town, the county, or whatever's put down, and hit the Find Support button, and then it would link you to that support area. So going forward, so on the areas, so they've got Bradford, Harrogate, Hertfordshire, Leeds, Wakefield, and we were all involved with developing and putting the content of the app together. If any other area wanted to have their name and details put onto the app, there will be like a small payment that's with the app developer as part of that ongoing. So it's trying to get as I said, it's on the Apple Store at the moment, and you just search Young Carer Support app, and it will come up. It's a little orange logo. It will be on Android, but that's apparently like developing another app. But this is the first version that was going live. So I can give you more details or put you in contact with the person that's developing it. But as I said, have a look, have a play. This is the first version. So if there's anything that you don't like or you don't feel is right, or the content, the words slightly, you know, don't resonate well, let us know and we can feed that back and get it changed. So like this last week, there's been a couple of things because the BAME terminology you can't use anymore, so it's ethnic minorities. So there's been a couple of tweaks that's been going in the last few days. But yeah, so it's an app to support all young carers. It's an app to support people so that you don't have to rely on a health professional or some other person to signpost you or to get you that support. So like with the Couth, if you're not really confident in getting mental health support or you don't trust that organisation, there is other organisations that are in the app that you could go to, different people you could talk to, or even different types of mental wellbeing or activities that may help and assist you. So there's quite a lot of information that's in there.
And thanks, Jodie. That's really useful. I think if you're able to send any information across, you got a round of applause there from Heather. So Heather seems to approve of that as well. So I think any information you've got would be great to hear about. That'd be perfect.
I've just downloaded the app and it does look pretty good.
I was just going to say, I think I could tell a few of you were already doing that. So, yeah.
And can I just ask, what locality did you put in? Because I think you've got to put a locality to proceed.
I just put as not listed.
Okay. Yeah, and from the organised, so like Caring Together, what they'll be able to do is they can track like the I don't know, the stuff behind the app. So if you've got your locality in there, like we've got Hertfordshire, they'll be able to track how many people that are hitting Hertfordshire. So it will give an idea of how many people are looking for Hertfordshire for their support on this app, and again with the other areas as well.
Brilliant, thanks for that, Jodie. It's really, really useful. I see we've got Karen. Karen's put a message in the chat just around some of the work around that they've been doing. So you've had some positive experiences around Couth, which is great. Do you want to come in around anything you've heard from that perspective?
No, just that it's been, you know, young people have used it and have found it easy to use and beneficial. That's it really.
No, brilliant, thank you.
I think with services like that, I think that, like you say, there's always going to be those positive cases, otherwise such a service wouldn't exist. I think it's more around the side that when you look at a lot of things, it's mental health is quite a new topic for a lot of people, and so are carers, and especially young carers. And I think in quite a few cases, they tend to tie the two together without necessarily realising the differences. So when you still get this, I think most of us will have heard the comments along the lines of, make sure you take some time for yourselves, or just take some time out. Whereas in reality, we all know that actually for young carers and young adult carers, that's not always possible, because their personal time at home isn't time for them, it's time looking after their loved ones. So I think there absolutely are good cases out there, and it's one that there will be a service for everyone. It's just about finding the right service and making sure they go through. But yeah, thank you for that, Karen.
Brilliant, thanks. Were there any other sort of final questions or any sort of final other observations that people had that they want to come in with at all? No.
I've just put in the chat the link to the app.
Brilliant, thanks, James. So James and co, I'm being led by you guys today. So in terms of if you want to, are you wanting to go back to the slide deck, or in terms of, so you put me down as closing remarks. For those of you who don't know, which I'll talk about in a second, these young people have been they planned the whole agenda. So they literally just emailed me saying, Andy, this is the bit you're doing. Not even is that okay? It's just, this is the bit you're doing.
I believe it is now me handing over to you, Andy.
Brilliant, perfect. Well, I think the first thing that I want to say is a huge thank you to everyone to attending, in terms of those who've given up their time to come along this evening, but most importantly, to the young people who are on this session here today and who've been presenting. As I said, this whole concept from deciding they wanted to do a survey through to designing the questions for the survey, encouraging other young carers to take part, We've had so many young carers and young adult carers go to visit other young carers groups to encourage people to be involved, putting the slides together. That's all been done by this group of young people and a wider group of young people who've been working on this over the past 3 months. So I think it's made my job really easy, actually, because actually I don't need to tell you what the key messages are. I think they've told it really powerfully for us in the slides. As I said, we'll be sharing the infographic that they've put together, as well as a sort of a summary of some of the headlines that people can use. But I think the 3 things that really stood out to me in terms of actually what needs to happen is in terms of, if we look at around education. So in terms of in total across young carers and young adult carers, 60% of them said that education had been negatively impacted. Over 70% said their mental health had been negatively affected. And I know we've talked about it a lot in this conversation just now. And 3/4 of young carers and young adult carers said they felt less able to cope with their caring role as a result of the pandemic. So I think I go to a lot of meetings and I talk a lot of presentations and I use statistics a lot. But I think for me, what's really concerning is just the sheer numbers of young carers that we're talking about. That's of 150. If we scale that up, we're talking thousands of young people whose education, whose mental health and aspirations have been really affected. So in terms of the whole point of Young Carers Action Day, it's moved from Young Carers Awareness Day, is because it's all about not just raising awareness, which the young people have done so brilliantly this evening, but it's about all of us here actually thinking about what are we going to do to make a difference and to actually act on this. So that if we come back in Carers Week in June, if we come back on Young Carers Action Day next year, we can hand on heart come back to these young people and all of those other young people who've taken part to say, actually, this is what you've said needed to happen, and this is what we've done to help you make that happen. So I think you've seen here, we've got a really powerful group of young people who are committed to helping making change. So if any of you are here sat thinking, actually, I really want to improve support for young carers, but I don't quite know how, we've got the young people through the Norfolk Young Carers Forum. We've also got young adult carers who've been involved from Cambridgeshire in this as well, really joining forces on this piece of work. So in terms of what we're doing as an organisation in response to this survey and what young carers and young adult carers have said, if it's possible to go on. So there are a few areas that really stood out to me. I think one of the key things is just the sheer inability to take a break, just how many young carers and young adult carers have missed out on that opportunity, either with their family or with their friends, or just having that meaningful break from their caring responsibilities. I think we've seen a real trend throughout this survey around siblings. And quite often they are able to access young carer support, or they sometimes miss out on it. So we've been doing specific work, particularly in Cambridgeshire, around putting in more breaks for sibling carers who are able to just have a go, whether it's with their sibling that they help support or with other young carers or other sibling carers as well. I think there's a huge amount more that needs to be done on that side of it. I think we've seen a lot come out around young adult carers' mental health as well as young carers. So we're doing some specific listening ear support, face-to-face and over the telephone for young adult carers. I think one of the really key things is, as colleges have reopened, as schools have reopened, and as society reopens, it's really going to be really positive for lots of us. But for lots of young carers and young adult carers, we heard it talked about earlier in the session, that actually this will prevent even more anxiety for them. I think when they've been at home, when they've had everything virtually, everything over the phone, they haven't had to worry about that choice between, well, I want to go take part in that activity or to get that support, but I'm worried about taking the virus home still. And it's going to be some time before that fear amongst young people and young carers does disappear. I think there's so much that we all need to be doing around employability for young carers and young adult carers. I think you'd all agree with me that just the professionalism and the skills that these young people have shown in presenting and facilitating a session, which isn't easy when you can't see the group of people in there, when it's just names, when it's just Zoom boxes, it is really tough. You can't gauge the room. So I think actually these young people have really demonstrated employability skills and sort of personal attributes that any employer would be fortunate to have. But what we've seen from the quotes and the feedback is actually that many young carers don't necessarily see that they don't see the support and the confidence that they have got they can produce. So I think there's a huge amount to be done. So we've worked, for example, with BGL in Cambridgeshire, who are happy to offer sort of one-to-one or group-based sort of employability support for young carers and young adult carers. We've done similar work for young adult carers in Norfolk. So Eloise and the team have been doing a series of aspirational talks. So we've had people, whether they are in terms of teachers, we've had nurses, we've had doctors, we've had people who are sort of CEOs of charities and organisations, coming forward to share their experience, share their career journeys. So what I'd ask you is, actually, if any of you think you can help, do get in touch, because the more people we have giving up their time for young carers and young adult carers, the more difference that we can make as well. And I think the final challenge that I really want to put to everyone is around the carer-friendly tick. So for those of you who don't know about the carer-friendly tick, it emerged actually from this group of young carers and a wider group of young carers through the Norfolk Young Carers Forum project around 4 years ago now. It started in education, so for schools and colleges, and it's a system and a scheme all about helping organisations to improve their ability to identify and also support carers. As I said, it started off from young carers. It's now been extended to health, to employers, and to community groups. So I'd put the challenge here to every single one of us in this organisation, or in this call this evening, is that every single organisation that we're linked to could be working towards the carer-friendly tick, whether it be the community one, whether it be health, whether it be employer, whether it be an education one. So I think the challenge I'd put to you is in terms of what's stopping you. You can see people in the chat who've said they've already got theirs, and it is something to be proud of, because it's not me who decides if someone gets a carer-friendly tick. It's not Eloise, who's one of my team, who works on the forum. It's actually carers themselves. So whether it be young carers and young adult carers, or on adult side, some adult carers as well, it's a process that's been designed by carers and is administered by carers. So it isn't an easy award to get. It's not an easy accreditation to get. But I think what I would really ask in that plea is, we've got 50 organisations now across Cambridgeshire and Norfolk who've got the carer-friendly tick. We're up to nearly 200 organisations who've signed up. But if we think about all the schools, the colleges, the GP surgeries, the employers, the community organisations, the social care teams, voluntary sector organisations, there are hundreds and thousands of those across Cambridgeshire and Norfolk. And so I think what I'd ask to you is, whether it's in your professional role, think about, could your team work for the carer-friendly tick? Or even in your personal life, if you've got a link to a school at all, asking that school, have you signed up to the carer-friendly tick? It's free. There's support available to achieve the carer-friendly tick. So I'd really love to be able to come back here in a year's time and say, look how many more organisations are carer-friendly and have actually put these things in place to help ensure that young carers, young adult carers, and carers of all ages have the same life chances as their peers as well. So I think that's everything from me. I just want to finish by saying an absolute huge thank you again to all the young people who've been involved in making the survey happen and making this evening happen. And just again, thank you for coming along, taking part as well. And for those who I haven't seen, look forward to speaking to you all soon. And I'll hand back to James and the other young people to finish.
I think that is us pretty much done.
Brilliant.
So again, from the young carers, thank you very much for attending tonight. It means so much for you guys to all to have attended and listened to us, and to have the opportunity to talk about this from young carers, as opposed to having it just talked at you from other people. You know, I know how much better it sounds when it does come from young carers. But yes, thank you very much for attending.